Dr. Alice Barsoumian.
Hi, I'm Dr. Elizabeth Markelz.
And we're here for our first Masked Friday Facts, and we just wanted to explain ourselves a little bit.
Yes, well, first, Happy New Year. And yes, and as you're probably aware, the rates of COVID in the community are rising quickly. And so we have decided, in accordance with guidelines, to wear a mask despite providing this brief update for you.
We had performed a couple of sound checks, so everything should be okay, and we appreciate you being flexible with us on this issue. It would be pretty inconvenient for the infectious disease service to lose two providers at once right now, and so we thought we would just be cautious. Well, today we wanted to talk a little bit about what to do when you're feeling sick. I've noticed long lines, and I'm sure that you've seen updates about long lines at the COVID testing site. So we wanted to talk a little bit about what to do if you're sick, how to view illness, what steps you could take, when testing is necessary, and kind of explore a little bit why it takes a long time to get results back from tests.
So first of all, if you're sick, please stay home. And many of you may have the capability to do a home test, the antigen test. And if you have access to that and you do that test and it's positive, that's enough, at least for our organization, for you to stay home, and you don't need to come and get a PCR test as well.
Yeah, save your time in the line, rest and recuperate instead. One thing to note, if your test is negative, it's possible there's a false negative, particularly if you were a close contact of somebody with diagnosed COVID and you have symptoms compatible with COVID. That would be a higher risk for a false negative test. But one thing to not forget is that there are other respiratory viruses circulating right now, particularly influenza. If you come through our COVID testing line with symptoms, you will also get tested for influenza. Right now, influenza A is the most circulating virus. That's usually what happens in flu season anyway, but that's one thing to take note of. So if you have a negative test, you still might want to stay home. I would recommend staying home. If you've been exposed to COVID, go ahead and consider yourself COVID positive. And if you are feeling unwell with the negative test, it's possible you have something else contagious that other people shouldn't get.
Absolutely. So please, if you have a fever, cough, please stay home during this respiratory season. The rates of flu are going up, and so this is different than last year where we didn't have any flu. We're now seeing pretty normal flu activity. And so far, it looks like the vaccine is a pretty good match for the influenza A, like the N3, N2, which is the most common one circulating right now. So for those of you out there who haven't gotten vaccinated for the flu, please get vaccinated for the flu. That's the best way to protect yourself from being hospitalized or having severe disease with the flu.
And I recognize that there are some schools or workplaces that will not take symptoms alone as a reason to stay home, and that's pretty unfortunate. But if they do allow that, I would recommend it. There are certain circumstances in which getting a positive COVID test or a positive influenza test is actually medically necessary. Elizabeth, do you want to go into early treatment?
So sure. So for COVID, there are some treatment options available for outpatient COVID. They're becoming slowly available throughout the city. And one of them includes a monoclonal infusion. And to get these tests, you will need to verify that you have a positive test. So these are usually targeted for people at highest risk of severe disease. So that includes older people, 75 and older, who are unvaccinated. So if you're older and you're unvaccinated and you have COVID, you would be a great candidate for one of these treatments and early interventions. Additionally, if you're someone who has a severe immune compromising condition where you may have been vaccinated and not responded to the vaccine, even with additional doses, then you could also be a candidate for early treatment as well.
Yeah, and so that's the monoclonal antibody piece. I know there's been a lot of talk about antivirals that have been going out and recently approved. The antivirals are not available locally. We do have to get all medications released at the national level. Monoclonal antibodies too are not administered by Brooke Army Medical Center, and so if you think that you would benefit based on what we have described, please go to the STRAC or STRAC website to find out how to get a referral and to get your treatment. All right, so that's COVID. Influenza has some early treatment approaches. If you are a close contact of somebody with influenza, so particularly if you're like a spouse of somebody who's sick, has positive for influenza, you might benefit from taking oseltamivir by prescription to prevent developing influenza. Also, if you're in a high-risk category, you might benefit from early acceptance of that antimicrobial as well. And those can be provided to you by your primary care doctor. What I would do if in this situation, if I had a positive influenza test, I would go on TRICARE online and reach out to the primary care doctor to try and get that prescription as quickly as possible.
Yes, not everyone needs to be treated
as well
for the flu, so keep that in mind. But certainly if you are someone who's immunocompromised, who is at risk for severe disease, then you certainly may want to reach out to your primary care provider to see if you're a good candidate for Tamiflu or oseltamivir.
Now, that being said, most of what we're seeing is COVID, consistent with city rates. So we are catching influenza, particularly as we're testing more people, but we're seeing an overwhelming amount of COVID, and so keep that into consideration.
So still think about the main things that we talk about with respiratory viruses. So again, the best way to keep yourself and others safe is to vaccinate when available. So that certainly is relevant to COVID and flu. But think about the way these infections are transmitted. So again, social distancing when able, wearing masks. These are good interventions to help prevent many respiratory infections. And then think about your hands. So again, like hand hygiene, think about the environment when you're eating, when you're drinking, and make sure you try your best to employ hand hygiene and disinfect your environment as well.
And throughout this time and throughout going forward, calibrate what you're going to do with trying to perform a risk assessment. It may be very important for you to see your in-laws on New Year's. I know it was for me, and less important for me to see the play for the holidays that were people unmasked. And try and pick and choose so you're able to spend your time doing the things that you care about. So again, testing is great. It provides a lot of personal information that I would find useful. But if you don't have access to a test, stay home. And there are certain circumstances, particularly if you're high risk, in which testing is, medically beneficial. But now we wanted to shift gears a little bit and talk about, the long lag time to getting your test results. I can't speak for the city, but we can sort of talk about processes in general.
So first you have to get the specimen, right? So you may encounter some lines for that. I know at our facility, they've been quite variable, but they've been up to 4 or 6 hours long. So then you have that specimen, that swab has to eventually make it to the lab. And those, as you can imagine, when you have thousands of people going through, they're not taking your swab directly to the lab immediately. So they're being batched, appropriately stored, kept cool, and then they'll go up together in a group. All of these are put onto a machine that can only handle a certain amount at one time, and it takes time to prepare the specimen, put it on the machine. You have to wait for the results and then verify the results. So all of this is what results in a significant delay between the time you give the test to the time your test is resulted. And typically your result may be available in 24 hours. But as far as getting the result, you certainly, if you could, through our facility, you can use TRICARE online. At this point, because of the high volume, we just do not have the personnel available to contact everyone regarding every positive. So please be proactive and use TRICARE online to look for your test results anywhere from 24 to 72 hours after you've gotten your test.
All right, well, that's it for today. We'll be checking the post once or twice on Friday when this airs to see if there are any questions we can answer. Everybody stay safe. Have a happy new year. I'm so grateful we're in a good place, by and large, coming into this new challenge. and I know we can get through it.
Yeah, absolutely. I mean, every day we're empowered with more information, and that's been very helpful for all of us. And we certainly have a great team here to keep us going and optimistic.
All right. Take care, guys. See you next time.
Happy New Year.